Hi, welcome to a new add-on for clinometrics. This is what we now call CMX Sidebar. This is a GP-focused tool. It can also be used in nursing, but predominantly aimed at GPs to allow very fast and quick access to patients' details, both appointment, scripting, chronic disease items, and the like. What you're looking at now is part of our demo deck, so you'll see all the patients' fake names. And obviously the doctors are also fake names, but this is kind of a model version of an actual appointment book. The reason for appointment would be the real reason in all the circumstances. What you're looking at here is all appointments that are going to be available within an hour prior to the current time. So at the moment it is 12:30 and we're now looking at all appointments from 11:30. This is to allow for any appointments that may be running late in the day. You'll see also here what the patient has booked the appointment for, or however it's been entered by your admin teams. On the approved items list, you will see whether there are chronic disease items available to be billed. This is using both the clinometrics analytics of is the patient eligible, and then tested against PROTA for eligibility as well. You notice up the top there are appointments for today, so 0 day, tomorrow being 1 day, and 2 days being the next 2 days from now, obviously. The system currently, as you're looking at it, is demonstrating what an admin would see. So all doctors' names are available, but of course, if it's just a single practitioner, it will only show that practitioner's list of appointments. So as an example, I will click on this demonstration doctor, and you will see that there are a list of appointments coming up today for Harlan Hafer. We can see on the right hand side that there's a list of approved items, and in some cases this is a significant number of chronic disease items to be billed. How does the tool work? Well, all the doctor needs to do is click on the patient name. It will instantly take them to the reason for the appointment, the last three reasons the patient attended. In this case, obviously it's the demo data, so that's not actually real data. Any abnormal pathology results that have come up for that patient, possible tests for that patient, then EPC and CDM eligibility, so patient's 83 years age and never had a health assessment done. The patient is eligible for 732, and the chronic conditions the patient has are hypertension, cardiovascular disease, hypercholesteremia, and arthritis. Patient's also eligible for a flu vaccine, and there's 2 pieces of missing data in that data set, being tobacco and blood pressure updates to be done. Once the doctor has seen that information, all they have to do then is click clear patient. It takes them back to the list, and you can go to the next patient. So the next patient may be this one, and again you will see more information for this patient. So this patient actually came in for reason 291. Obviously that will be documented per the data. Has 3 recent abnormal blood tests going back to April of 2024, and needs a list of tests that could be done down the bottom. Is eligible for both a health assessment and a TCA and review, and they have hypertension and hypercholesteremia. Hasn't had a flu vac this year, and there's missing data, and the last 3 scripts are listed here. Why have we built this tool? Well, the answer is that it's a very, very quick way for the doctors to simply glance at all the key clinical data without having to use the best practice menus to open and close drop boxes and get a very, very quick glance at why, what, and can be done. It also provides that pushback on PROTA, so you know exactly what's actually eligible for the patient at any particular point in time. For the nursing teams, it will behave slightly differently. And of course, what that means is with this list, the nursing team can see any doctor, any patient name for all appointments coming up. And if these appointments are in the waiting area or attending, they can obviously grab the patient from the waiting area and work through any processes that need to be done for that patient. So if that patient may be coming in for just a normal visit, but we're missing blood pressure, alcohol and tobacco data, then nursing could grab that patient and do those measurements before releasing them back into the waiting area for the doctor to see. It's also a really quick way of actually allowing the nursing team to see who is eligible for these chronic disease items, measured against both the clinometrics data and PROTA, to say, let's book them in, or let's put a note in the GP's appointment book. Of course, the other asset for nursing is it's not just about appointments today, it's also about appointments that are for tomorrow. Right now, clinometrics is updating nightly, but as we progress through 2025, we'll be actually adding a more regular update process so that this data will be more available to you as live data for any appointments that are booked on the day. So that's sidebar. The actual design at the moment, this is the actual content of the information. The design of the data will be that it will act like a slider. So what will happen is you will see this page on a single button that will be slide in or out from the right hand side of the screen, only locked to the user, so each doctor can only see their own data. Very quick, very powerful tool, great for clinical purpose, great for checking all that information that would normally take 3, 4, 5 clicks to get to in BP, and then you can be straight into the consult time. So saves your time as a GP, provides accurate information, instantly responds to PROTA checks, they're already done, and so you know exactly what you're doing as the appointment commences. It's available shortly. It is $390 per GP. It does not require a license of clinometrics. It just requires the GP to sign up and then the practice to agree to install the extraction tools, and it's good to go. If you've got any questions, you know where we are, clinometrics.com.au.